Good evening. My name is Chinonso Akano. I'm a pharmacist by training, and I currently am one of the principal medical scientists at Gilead Sciences. I am one of the co-authors of this poster, along with my colleagues. We're very honored to be part of the 16th Xavier Health Disparities Conference, and I'll be presenting this poster on behalf of my colleagues who were not able to make the conference. Now, the title of this poster is basically a survey, a Harris poll survey that it was geared to explore the health inequities among white, Black, and Hispanic patients, specifically looking at the differences in perception of COVID-19 healthcare and its delivery. So as we know, this disproportional impact of COVID-19 infections here in the US, and the mortality rates are quite high in minority populations. And these reports are well documented in the literature. But beyond these clinical outcomes, little is quite known on the impact of race on hospitalization, as well as satisfactions and how patients actually felt. So this survey was conducted to understand how and if the health equity gap was impacted, and if the patient perceptions of their COVID hospitalization care was actually received or not. This survey was done across the United States. Figure 1 shows us the spatial distribution of survey respondents. And this was done basically to really capture respondents in the US, and we did make sure that some of the survey samples were actually weighted to really reflect the key population benchmarks and accounted for education, race, gender, ethnicity, census region, household size, as well as marital status, and each patients were evenly distributed. Each patient population were evenly distributed. Figure 2 actually gives us a highlight of what the patient access to care and so on, the social determinants of care really looks like. There's a spidergram on figure 2 that really puts into perspective specifically how Black and Hispanic patients, when compared to their white brothers and sisters, face unique challenges in access to healthcare and more likely to experience health disparities or inequities due to social determinants of health, which I think is not news, but this is information that really captures it in a very nice and succinct way. Now, the results, additional results that we also got from the survey with regards to satisfaction with healthcare delivery. Now, most notably from the survey, it was clear that Black patients were 2.5 times more likely than white patients to mention issues related to bedside manners. Some of those bedside manners included level of personal attention or care that they received, or the staff not being sympathetic or compassionate enough. In addition to that, Black patients were actually 5 times more likely than white patients to describe their healthcare team, as being careless, while Hispanic patients were 2.5 times more likely than white patients to describe their team as being aggressive. Now, all in all, the conclusion we made from this poster, which I find very interesting, is that by capturing these perceptions of healthcare experienced by these patients firsthand, the survey did contribute to our understanding of health disparities beyond the clinical outcomes that some of us are used to. In addition to that, Hispanic and Black patients who have experienced COVID-19 are more negatively impacted by these social determinants of health. Now, we know that successful interventions are aimed to address these disparities, and patient-centric approaches are absolutely needed. However, we need further studies or further surveys that are properly done to really better disentangle or give us some clarity between these perceptions of healthcare delivery, standard of care, and some of these health outcomes that we so are eager to understand. So this poster is a very interesting poster, and I hope you enjoy it. And please feel free to ask us questions at the conference, which we'll be very much glad to elaborate more on. Thank you very much for having us, and it's a pleasure, and have a wonderful day. Thank you.